missing Phil. We're missing Phil Stockton.
Good afternoon. Welcome to the Human Service Committee meeting. We will start with roll call, please.
Mrs. Burdick.
Here.
Mrs. Ricketts Wales.
Here.
Mr. Barnes.
Present.
Mrs. Hanchett.
Here.
Mrs. Root. Mr. Rumfelt.
Here.
Mr. Stockin. Mr. Harris. 6 present, 1 absent.
Thank you. And can I have a motion to approve the minutes of January 17th, please?
Rumfeld, move.
Ricketts Swales will second.
Any corrections or additions? All in favor?
Aye.
Carried. We will now go to Anita Masson, Director, Office for the Aging. Welcome, Anita.
Thank you. All right, so the first thing we have is the monthly report. And I apologize for that being late. I know that you did receive that, I believe, this morning, so that I own that one. Sorry about that. The first thing I'd like to highlight is the calls again continue to go up at the front. We do have some that are missing here because of some technical issues with our statewide data system. So we are still updating that. They did change how we track things, and so it's a learning curve for everyone. But our numbers are continuing to go up with calls at the front desk. Insurance counseling. This does reflect the end of open enrollment, which all of our insurance counselors were very happy to see come. It is a very busy time for us, even though we do insurance counseling all year long. That is a crunch time within a very short period. So, was there any questions on the monthly report?
I guess not. I guess you can move on to,
All right.
you have a
Thank
bunch
you.
of other stuff for us, I see.
Yep, so the first thing we have is I am asking to create and fill a deputy director position at the Office for the Aging. This would be in the amount of $63,800 to $69,100 with benefits of $25,195 to $27,288. It is 100% county share at this point. This was not included in the 2024 budget.
I know this will be the same question for all of these, that
Okay.
the new positions. I assume you've met with Terry and Carissa and Allison, and they've been able to find money for these positions since they're going to be all county funded?
I met with Bobby, I met with Carissa, and then Carissa took everything, I believe, back to Terry.
Okay, and this is okay? You're able to come up with the money for these positions?
You'll have to take it out of contingency, and I think you do have a lot of things competing for contingencies. So that, something we'll talk about when we get to Ways and Means. When I talked to Anita, just listening to her need for these positions, I thought as though it should come to committee to make a decision at the committee level whether you wanted to continue the conversation or not. I think it does merit looking to see if we have the money, but I didn't see anything that made me stop the conversation flat on its tracks, I'll put it that way.
Anita, could you just explain to us a little more about why you need not just this one, but all of the ones you're requesting?
Sure. So the deputy director position is separate. Currently, it is the coordinator of services that we have, who is an acting deputy director. There are things as coordinator of services without the deputy director title that she's not able to do. Some fiscal things like transferring money, signing different payroll things or staff things. So as a deputy director title, then she would be able to do some of those activities. A coordinator of services acting as a deputy director doesn't hold those things.
So what will happen to that coordinator of service position?
I'm looking to fill that as well.
That's it, okay.
Yep, I am looking to backfill.
Okay.
That, along with the fact that our clientele is aging in, we have more individuals who are over the age of 60 currently. And it's going to continue to go up. By 2040, we're looking at tripling our population that we serve. And if I don't somehow offset it with staff, then we either don't serve everybody or my staff burn out on me. And then we can't retain staff, which our goal is to do that. We have one of the highest retention rates in our department, I think. We have some people who have been there longer than I have. And people want to retire and actually come back to work for us, so.
And then I'm assuming that these are positions that you want to keep permanently, so in the next year, they'll be in the future budgets.
Correct. Yep.
And there's no state funding for any of these positions?
Yes, so right now, we don't have the NGAs from the state showing us what our allocations are. This might be offset by whatever our allocations are. If we get additional supplements, these numbers might go down, but right now, I don't have those 2024 NGAs, so I can't project what they're going to give us. But in the 2025 budget, these would be included into our state, federal, and county funding. So it would be spread across. It would just be because it's not in our 2024.
Right. And if these are approved, how soon do you look at hiring? Do you have people in mind to fill them, or?
For some of them, so coordinator of services, who's acting deputy director, we would move to the deputy director position. We already have possibly a couple people interested internally for the coordinator position, and so I am looking to backfill, because we always want to promote within
Okay.
first.
Does anybody have any questions for Nita on these? I know dollar-wise, it adds up to quite a bit over the 4, but, if anybody has any questions or concerns that they'd like to express, now's the time to do it, so. Mr. Barnes?
So what is the total dollar amount that, if we approved all of these, including not only salary but also benefits?
I'm gonna have to remember this one because this was from our last meeting. I didn't pull it, but I believe it was 191. I like her number better, but, I know I was at 203 and we came up with 66,000, a little over 66,000 that we have, that we know that we will be allocated, so we took that off and didn't include that in county share. But let's say between 175,000 and 190,000.
Terry was just doing some quick math. She thought 170 for the ones that aren't in the budget, and that's without fringe.
You gotta add another 40% for fringe, so you're talking 225 probably, 230.
So there really are two separate parts to this process. There is creating the position and there is filling the position. And whether or not you want to debate the finances or whether we have the ability to fill them this year or next year, might be separate from whether you want the resolution that creates the title that then gives you the flexibility to make the next decision on filling it. My recommendation is if these are titles we're looking at, do the resolutions, so you create the titles, they're within our HR arsenal to fill whenever we feel that we can fill them.
Looking at the positions, there's 2 that are created positions, and it looks like 2 are existing already. Those are the backfills, right? Or no?
So we are looking at creating the deputy director position, which has never been at the Office for the Aging. The other position that we're looking to create is an aging service specialist, but we already have aging service specialist. I'm just looking to add an additional one. The aging service specialists are our case managers for home care, our high cap counselors also do home delivered meals, caregiver counseling, and Alzheimer's. So those are the specialist levels, and so I'm just looking at adding one additional person. So the title is already established. I already have 5 aging service specialists, but I am looking for another one, and the first one, which is deputy director, is a new position that is not currently at the office.
And Bobby's already approved these?
Yep, I met with Bobby first to talk about everything.
Okay. Any other questions or
Yeah,
comments?
I have one.
Yeah, Mr. Rumfeld?
So on the benefits for aging services specialist, the new position, it only adds up for funding sources of 95%. Is that a typo, or is that just, it says sourcing and funding for benefits, excuse me, 35% county, 52% state, and 10% federal, and that's only 95%?
Yeah, that would be a
Just
typo, but I can
okay.
get that corrected
Okay,
because,
just wanted to,
are you, I don't have my, I'm not on this one.
yeah, there's nothing,
In the book, in the packet, it doesn't have other down though. Does yours have other on it?
One of the aging specialists has 225666. Right. The other
Yeah.
aging specialist,
They have it right in the funding for the position, 335215, but for benefits is 335210. See, I actually do read these things. Yeah,
Yep.
I just didn't know it was a typo.
Yeah, so we'll get that corrected. The one that you're looking at, Terry, is actually the one that's already created that we were looking to, that would be a backfill. We're asking permission just to fill that position that's already in our budget. But the one that is create and fill, we believe will actually be filled within, so we took some numbers for there, but that doesn't add up, so I'll get that corrected. Yep.
All right, well, let's take them one, yes, Mr. Barnes.
I've got a question about the numbers of people that you are servicing today compared to before, say 2000, before COVID. Is it-
So just to give you an idea, we're at about 100, just in MIPA, which is one very small program for insurance counseling, Medicare savings programs, and extra help. We were at a 400% increase from 2019 to 2023. In people served, a 400% increase, just that one program. For HICAP, which is the health insurance counseling program, or Medicare insurance counseling program, which is much larger, we're at 150% increase in people served. Now, those two examples are just people, but when the cases are more complicated and it takes more time, what we are seeing is a trend where in 2019, it might have taken an hour to do a service, and now it's taking 3. And so we can't serve, my staff want to do the best they can, and they need to feel like they have the time to do that. But when it's taking longer, and we're still trying to serve the same amount of people with the same amount of people, they don't feel like they are able to do as good of a job.
So, the number of people in Allegheny County that, what is it, what's the age, 65 or and above, or?
Well, it's 60 or over for our
60?
office, for anything but New York Connects, which is anyone under 60
So,
too, with a disability.
the numbers of total people that are 60 and above in the county, what percentage are you serving?
Currently, of the total population, I would have to go run numbers, but I believe right now effectively, I think we're at 35%.
So,
But that's not necessarily meeting the need, because we now have a waiting list for services, such as PERS and legal and home delivered.
so,
Not home delivered.
so you're saying that 65% of the above 60 population is not at the current time using your services?
Or is on a waiting list to get our services.
Approximately
Or-
how much are on a waiting list?
I would have to go back and look, because I believe on our monthly report right now, you can see here, back in, was this November, December, we had 46 people on our home care waiting list. We had 22 people waiting for a personal emergency response button. And then the criteria for different programs, such as caregivers, the state has changed those. So I can see where we are going to be having an increase in a waiting list there, because now we have to do case management for any caregiver who calls our office, and do 2-month follow-up calls for any caregiver. Whether we provide home care or not, it's any caregiver who calls looking for services. So the state is changing those things, and I can see where we're gonna be having a waiting list, because we're not gonna be able to meet that need.
And one last question along the same line is, so starting at 60, most people at 60 are still working. And I would assume that they're not, a very low percentage of those that are still working are your customers at the present time. So at what age do you find that the percentage of people that are using your service goes up to 80% or higher?
Depending on the program. So 65, it skyrockets, because that's through our insurance counseling, right? If people are looking to retire, they want to know what it looks like when they're getting Medicare, whether they have to take their Part A, Part B. So for age 65 and in our insurance program, that's higher than it would be, let's say, for home delivered meals. So it really depends on the program. Our home delivered meals program, our average age is about 72. And that actually has dropped. But then that age would be different than home care. So to say for the agency, I don't think I could give you an age, but I can kind of tell you for programs.
Well, the reason I asked that question, of course, I'm 82, and a lot of my friends, I've talked in general terms, have never used your services, and I'm just wondering, that's where my questions are coming from.
And that's great if they don't need our service and they're able to find everything, but is it that they have supports and they're getting information through somebody else? We are finding that people are calling for somebody and passing the information along. So that person technically hasn't called our office, but they're still getting the information from our office, and we have found that multiple times.
Thank you very much.
You're welcome.
I got a question for Mr. Barnes. What is the population in your district, and what is the average age? You kind of threw the same thing at this nice young lady she didn't have answers for.
Those are legitimate questions.
Did you possibly expect somebody to have answers?
Okay, let's get back on track if you two want to discuss that later, but we need to stay because we got quite a full agenda. Thank you, Mr. Sear. If there's no other questions on any of these, we'll go on and approve each one individually so that we know if everybody's in favor of each one. So the first one is to create and fill the Deputy Director of Aging Services. This is a newly created position and will be funded 100% at the county at this point, correct?
Longfellow to move that.
Any other talk about this one?
Is this to create and fill? I'm sorry, is it to create and fill?
Yes. Yep, that one is a create and fill position.
All in favor? Okay, Mr. Barnes.
If we go ahead and approve this at this time, is there some time in the future that we can review it again before it's finalized?
It'll go to Ways and Means, correct?
There are gonna have to be several MOEs to do a budget adjustment and figure out where that money is gonna come from. And I'll be perfectly honest, that there is not a lot of wiggle room in contingency. I was not aware that this was coming forward to ask for that much money from contingency, so I'll have to go back and do some homework myself. And the rest of the opportunities, the rest of the accounts for opportunities to pull money from, we won't know until we close the books for 2023, which will not be until the end of April. So this could be a long process for this, so just so you're aware of that.
Okay, just from what I understood, at this point, we're looking to create these positions and then down the road, figure out when we're able to put them in and fund them. So that was my understanding of what we're doing with these right now. Create positions.
Well, we're gonna give permission to create and fill it. And then it'll have to go to Ways and Means, and then it'll go to, from there. So,
What I might suggest you do is just refer these on to create and then maybe table the request to fill at this portion. Because I think if it's budgeted and you grant the request to fill, I don't think it necessarily goes back on to any other committee. So to keep them all together, I would just table all the requests to fill, but move on the request to create the positions, if that makes any sense.
Doesn't it have to go before the full board, though, after it goes through here? or-
So if it's creating a position, it goes from here to personnel and Ways and Means, I believe. Personnel, depending on if they have the title already in the department. And then it goes on for resolution. If it's just to fill, if it's budgeted, it ends here. And if it's not budgeted, it would go on to Ways and Means, and then we would also need an MOE to transfer funds. It's a very complicated process for something that sounds straightforward.
so what you are suggesting we do is just create the position at this point?
Yes, and then table the request to fill, and we can have more discussion on that.
So can I have a motion for that then?
Longfellow make that.
Hanchett will second.
All right, does everybody understand what we're voting on? Mr. Healy?
Thank you. You're still going to have control over the filling process via the budget, is that correct?
For most of these positions, but I think the backfills are already budgeted.
Right.
So that's where, if you want to keep the conversation all together, I would just move forward the create and table the fills.
Right, but they'll still have some say when it comes time at budget time. Thank you.
All right, so does everybody understand that what we're doing right now is we are requesting to create the Deputy Director of Aging Services and table filling of that position at this point until we're sure where the money is going to come from? Is that
I'm
correct?
going to throw something in there, and I just want part of our conversation. So there are two positions that we actually did include in our 2024 budget. Could we go through those positions? And, because they actually were in our 2024 budget and are budgeted for at that level, which is the promotion of two of our aging service techs to aging service specialist. We had included those aging service specialists in our 2024 budget. Would it be possible to approve those?
I think that's up to the committee. It just depends if they want to separate out some of them or keep them all together.
Okay.
I'm suggesting we do each one separately so that we can approve the ones that are backfills and get those filled. Okay, so my suggestion, the motion on the floor is just to create the Deputy Director of Aging Services and table filling it. Is that correct? That's correct. Yeah. Okay, so we have a motion and a second, I believe, on that.
I'll make the motion.
I think we already have it. Yep, so all in favor of that one?
Aye.
Okay, so then we go to the next one, which is also a newly created position, and that's an aging services specialist. This, again, is going to be the same situation as the previous one. So this one, we are going to take a motion to create the position and table filling it.
Rumpfeld will make a motion on that, too.
Hanchett will second.
Is there any questions on that? And looking at the back table, we got that one correct, doing it that way. Okay, all in
So this
favor?
is one of the specialists that we did have budgeted in there. Yes, so this is one of the two that I talked about, this specialist and the other one are the ones we needed to create. This one, we have that budgeted in our 2024 budget. So this one is not 100% county share, like the deputy director was. This one is actually already included in our 2024.
So we can request to create and
I'll
fill
amend-
this one.
I'll amend my motion to that.
But you don't want to do the backfills, correct?
Correct. I don't need to do backfills because at this point, the technicians that they would be vacating those positions are not in our 2024 budget.
Okay.
That again would be county share. So those we would have to separate and put those with the deputy director position.
Okay, does everybody understand that?
Yep, Rumpfeld will amend the motion to that.
Hanchett will second.
So what we are going to do on this one is request to create and fill. All right, all in favor of that one?
Say that again.
We're going to request to create and fill this one because the other position was budgeted, even though it's newly created.
Is that good?
Okay?
Okay.
All right, all in favor?
Aye.
And that one's carried. Then we go to the aging service technicians, which there are two of. These are existing positions?
They are, but these are the two positions that the specialist or soon-to-be specialist would be vacating. These would be backfills. So at this point, if we are, I don't know if we want to just table this.
I think tabling these two would make sense.
Okay, all right, so we're just going to table these because these would come out of
It will all be
contingency?
contingent on what happens with the deputy director position.
Okay,
and
all right, so can I have a motion to table this request to fill of the two aging service technicians?
Ricketts Swales will motion that.
I get a second?
Hanchett will second.
Any questions and further discussion on that? All in favor?
Aye.
Carried. And that's it, right?
Nope,
We have one more.
Aging
Yeah,
service
yep, yep,
specialist,
the
I'm
aging ser-
sorry.
Okay, yep.
And this
right.
is just a request to fill. Again, this is already budgeted in our 2024 budget. This would be promotional from the aging service tech, or one of the two aging service techs to a specialist position.
And that specialist position is already created, right? Yeah, okay, so can we have, so what
No,
we're doing
I'll
with,
move that.
okay, everybody understands what we're doing with this one? Okay. Do we have a second?
Second.
Any questions? All in favor?
Aye.
Carried.
Can I just recap?
Yes.
Okay, so I just want to make sure that I'm on the same page. So we
Yep.
did permission to create the deputy director position, which we are tabling the request to fill until there's further discussion. And possibly closing the books, right, and looking at finances. We are doing the request to create and fill the one aging service specialist position, but I do need to get the corrected numbers for you. And that one is already budgeted in our 2024 budget, and that's going to be promotional from one of our aging service techs who are going to be going to a specialist. The 2 aging service tech positions, we actually tabled that one because that one's going to be contingent on a backfill from the aging service, or the deputy director, and then going down. So we tabled that one. And then the other aging service specialist, which is just a create to fill because that position has already been created in our office. We just haven't filled it. We're just asking permission to fill that, and that did pass, and that is included in our 2024 budget. Just so everybody's on the same page?
Yep, that's what we've got too. Thank you, Anita.
Okay, thank
All
you.
right, so we look forward to future discussion on these.
All right, thank you very
And
much.
hopefully future funding for them too,
Great.
because I know they're needed.
Yes, very much so, thank you.
All right, thank you, Anita. Tyler, Public Health Director, welcome, Tyler. You have his monthly report in front of you. Anything you want to point out today?
Sure, a couple updates for you. We are at the highest level we've ever been with our WIC participants. We're at 1,072 participants right now. There is a correction under the Children's Services. The year-to-date number of services provided for 2024 should be 546, not 4,187. That was just a copy and paste. Sorry about that. And then one update I have, I left a flyer on everyone's desk for the free rabies clinic coming up on April 27th at Genesee Valley Central School in the bus garage from 9 a.m. to 12 p.m. and pre-registration is required for that. Any questions?
So we have some agreements that we need to look at and approve.
First up is our Cancer Services Program Provider Agreement. We need an agreement with the Cancer Services Program that serves our 4-county area in order to make referrals for uninsured or underinsured individuals for cancer screenings.
Can I have a motion to approve that one?
Rundfeld will move.
Ricketts Wales, second.
Any questions or comments? All in favor?
Aye.
Carried.
Next up is the Cattaraugus County contract for the HUD lead grant. I know there's been a lot of contracts coming through. This is a federal grant, so there's a lot of paperwork. This is actually the grant with Cattaraugus County to actually get reimbursed for our expenses.
Handship moves.
Rundfeld will second.
Any questions or comments? Now, this is the grant that you got with Cat County, but it's administered by Cat County, is
That's
that
correct.
correct?
Yep.
All right, all in favor?
Aye.
All right, and the WIC grant?
For the WIC grant, this is the Grant and Brinks contract. This is for their telephone service system that was installed back in 2015 at their office.
Stock and move.
Handship seconds.
Any questions or comments on this one? All in favor?
Aye.
Carried. And finally, the Rochester Regional Health Lab Service Agreement.
Yep, this is a lab service agreement for our sexual and reproductive health program, and you'll see that there was no cost increases from the previous contract last year.
Rundfeld will move.
Ricketts Wales, seconds.
Any questions or comments? All in favor?
Aye.
Carried. Anything else, Tyler?
The only thing I wanted to add is we did have a report today that we did have a positive raccoon. So that'll be coming next month. You'll see that on my numbers in the town of Hume.
Thank you for that.
I have one question for
Yes.
Tyler. I ask it all the time. What's the status of the AED for this floor?
We did talk about it at the safety committee. I don't know if Kristen wants to chime in on that one.
I think we really should have one here. I really think it's a good thing to have on
So
this
the
floor.
assessment on AEDs is, and I can't remember off the top of my head, but you need to be able to locate one and get it back to the person within X amount of time. And we do have several in this building in particular. The thought was we didn't need one on this floor as we have one right above us and right below us. So we do have Bonnie at Emergency Services. They've surveyed all of our county buildings, and we are purchasing several dozen AEDs, but I don't believe second floor in particular was targeted for one. Based on availability of others within, it would be easy to run and get one and right back in time.
Is it on the second floor? I thought it was on the first floor.
So we are on second right now, and I believe there's one right above us in Tyler's department. Is that correct, Tyler?
That's correct. Yep.
And then there's one on ground. I'm not sure about first off the top of my head.
So
Yeah.
it's a little bit of ways.
but Bonnie did go through, there were questions about locations in each of the building and being strategic about where we put them.
Now, I remember several years ago when I was on the old EMS committee, they got grants for them, and they supposedly Jeff had got them for every floor in this building.
I think Tyler actually was the one that purchased the ones in this building.
Okay.
I did, yes.
Any other questions or comments for Tyler today? Thank you, Tyler.
Thank you.
Don from Social Services. Welcome, Don.
Thank you. Good afternoon.
I see you've been busy and have lots for us today.
Lots and lots. But hopefully we'll get through it very rapidly.
Yes. All right, anything you want to highlight on your monthly report first?
The monthly report is pretty consistent. It's been very cold, so of course Cold Blue numbers went up again. But all the other numbers are very consistent. I don't see a lot of fluctuation there.
Any questions on the report? All right, we are going to move on, and luckily, Allison, I believe, has allowed us to block a group of these together. So I'll let you take it from here, Don, and you can just,
You want me
which
to
ones.
do the request to fill first, or?
Oh, I'm sorry.
No, that's okay.
That's
I
the-
can do that last.
Yeah. Where, oh, yep, I'm sorry. The
No, that's okay.
account clerk typist, correct?
Yes.
Okay,
this
yes,
is-
let's do that first.
Okay. The account clerk typist is due to a retirement within the accounting unit in social services. This is a person who helps process payments and oversees the BIX operation systems.
Hanchett will move.
Ricketts Swales will second.
Any questions or comments? And you can see that that's federal, state, and county funded, so.
Yes.
All right, all in favor?
Aye.
Carried. The support investigator and any resulting backfills.
This is also due to a retirement at our support investigators unit at child support. It's 66% federal reimbursed.
I'll second.
Any questions or comments on this? All in favor? Aye. Carried. Okay, now we can move on to the contracts.
Okay, I'll try to keep these in groups the best that I can. The first set of contracts that we need to renew are for the Child Advocacy Center. I have 4 groups there. The first one is going to be for the Cattaraugus County Sheriff's Department for the law enforcement piece of the CAC. That's for investigations, interviewing. They also oversee the Celebrate system, which extracts data from phones and iPads, et cetera, that have been deleted.
Can I have a motion for that one?
Hanchett will move.
Ricketts Swales will second.
Any questions or comments? All in favor?
Aye.
Aye.
Carried. And the next one is the standalone.
Yes. This is for the Cattaraugus County Rehabilitation Center. This is a fee for the maintenance and the cleaning of the Olean office for the Child Advocacy Center.
Stock and move.
We have second.
Hanchett will second.
Any questions or comments? All in favor?
Aye.
Carried. And then we're going to block the next 1, 2, 3, 4, 5, correct?
Yes. This is going to be for medical at the CAC. This is for Dr. John Coyne. He's our oversight of medical for the center. Brandis Gaylor is a sexual abuse nurse examiner. Cheryl Wire is also a sexual abuse nurse examiner. Olean General Hospital is for the supplies that we need for those examinations. And Dr. Craig Zuckerman, he does the psychiatric evaluations when requested on those who need it at the center.
We have a motion to approve those 5.
Ricketts Swales will move that.
Second.
Hanchett will second.
And these are all in the budget, right?
Yes, these are all in the
Just want to
budget.
make sure we all knew
Yes.
that. Okay, all in favor?
I just
Aye.
have a
Yes, Ms.
question.
Marshall, sorry.
So it says per the Medicaid rate, what do we know what that is and what we're paying
That
for?
is directly billed to the state level Medicaid.
Okay, so that doesn't get billed, we don't know, that's not.
No, they
okay.
use the Medicaid rate when they bill that right from the hospital.
Okay,
Yep.
All in favor?
Aye.
Carried. The next one will be a standalone.
Yes, this is where we'll move into social services. The first one is going to be Laboratory Corporation of America Holdings. We do a contract with them for child support enforcement for DNA testing to prove who is the father in court.
I have a motion for that one.
Rumpfeld.
Oh, Ricketts Swales, second.
Any questions or comments on that? All in favor?
Aye.
Carried. And then the next two for Accord, we will block together.
Yes. The first one for Accord is for our non-residential domestic violence program. This is for family assessments, risk assessments, and safety planning for those who are referred to the program. The second one is for our Chances program. This is an 18-week domestic violence educational programs for survivors of domestic violence.
We have a motion for those two.
Hanchett will move.
Rumpfeld, a second.
Any questions or comments? All in favor?
Aye.
Carried. And then the next three will be standalones.
Right. The next one is going to be for Southern Tier Traveling Teacher. This is for education. They are referred over to Southern Tier Traveling Teacher from our employment unit. Some of our programs do require them to pursue their GEDs and to help do job management and job search.
Stockton moves.
Ricketts Swales, second.
Any questions or comments on that one? All in favor?
Aye.
Carried.
The next one is for Legal Assistance of Western New York. We use them to help refer people over who are applying for Social Security income. And that is a mandate by the state. We have to have somebody to help them. And also, if there's somebody else who needs legal services that come to our office, we can refer them over there for help also.
We have a motion for that one.
Ricketts Swales, I'm gonna move it.
Stockton second.
Any questions or comments?
I have a question.
Yes, go ahead.
So, as we go through these, and a lot of them are people that we've always used, and that, do we ever rebid, or is there anybody else that does some of these services available ever that we source a little bit?
We use the available resources that we can get, but we're pretty limited to the people in the county because there are only so many slots that we can pay for the preventive programs or other programs. And then we do sometimes branch out to other counties, but those counties are using those same services that we do.
Thank you.
Yeah.
Any other questions? All in favor?
Aye.
Carried.
I'd like to go on record opposed.
Sorry, I should have said anybody against. Okay, and the next one.
The next one is for Dr. Scott Anderson. He does psychological evaluations for families who are referred for those evaluations. Sometimes they are court-ordered.
I have a motion for that one.
Rumpfeld, a move.
Ricketts Swales, second.
Any questions or comments on this one? All in favor?
Aye.
Opposed? Carried. And then we are going to take the next group down to the last ready and block
Right.
those together.
Right. The first preventive contract is the after-school program. That is a program that is in Genesee Valley Central School and also Bolivar Richburg. It's a mentoring program for children of those schools. The next one is for Catholic Charities. This is a mandated program for respite. This is mostly for a person in need of supervisions or a juvenile delinquent, and it's used for emergency temporary housing. These children are not in our care. The next one is Hillside Children's. That is for in-home parenting. These are programs that we refer the people that we have in our services for parenting skills, education, childhood development, and child behaviors. The next one is for Hillside Children's. This is the one family contract. We use this one for group decision-making within the family unit, family meetings, helping the family find resources, family supports, and family placements. The next one is the Parent Education Program for Families Together. This is a more intensive preventive program for in-home parenting. They actually go out and they will meet with the family at least 2 to 3 times a week to help them with parenting services, how to deal with crisis within the home, etc. The next one is the Parent Education Program, which is Families First. This is a continuation of Families Together. When people come out of Families Together, we use this program to monitor their progress, to make sure that the services that they got in Families Together continue. Some people will go straight into this program if they don't need the intensive Families Together program. The next one is READY, and I actually remembered what that stands for, Restructuring Empowering Disadvantaged Youth. The first one is community-based mentoring. This is for children in schools, school needs. If a child has a lot of absences in school, they may refuse to go to school. Child's socialization skills. They're mostly not a rule follower. They do intensive redirection for those children. The next one is also a READY program, that's foster care transition. This is for parenting education, coaching the parents, and helping them interact with their child with suggestive techniques, and helping children that are in foster care come out of foster care. And that's the last preventive one.
Do we have a motion for those?
Ricketts Swales, I'll move that.
Second, Gary, Mr. Barnes. Any comments or questions on these? I just have a question. Where is Ready out of? Is that an Allegheny County agency? or-
No, that's actually out of Ohio, I
Oh.
believe, and they use Allegheny County workers here
Oh, okay.
that are located right here.
Okay.
So,
Are they county employees then, or they're?
no, they're Ready employees.
Okay. Okay. And the same with the other ones, I assume? They're.
Yes.
Yeah.
Yeah.
Okay. Any other questions?
Yes.
Yes, Mr. Barnes?
Several of these, you talked about parental help or whatever,
Yes.
education or whatever. Why is that spread over 3 or 4 different, why isn't it just one agency?
Because there's only so many slots per agency, and depending on how many families or how many children come into care, one agency might be completely full, and we need another agency to work with.
So, in other words, you've got 3 or 4 different agencies that can do the same thing, and you move them around, move people to wherever there is a slot available, is that what you're saying?
Yes.
Thank you.
Any other questions? All in favor?
Aye.
And that's carried. Any opposed? Sorry. Carried. And then the next 4 are going to be blocked together.
Yep, that's going to be for our qualified individuals. That's going to be for Allegheny County Community Services, Berkshire Farm Center, and Catholic Charities. A qualified individual is a person that we need to use when a child is placed in a qualified residential treatment program. This is part of the Families First federal legislation that's coming out. To gain 4E reimbursement, we're under a 30-day reporting period back to the court, whether they agree whether that child was placed or not placed. If we miss that 30-day mark without having these reports submitted to the court, we could lose our 4E funding for those children.
Stockton moves.
Hanchett seconds.
Any questions or comments on these 4? 3, sorry. 3. All right, all in favor?
Aye.
Anyone opposed? And carried. I think that does it, right?
Yes, it is.
Thank you very much for making it easy
Yeah.
for us and explaining them all to us, because there's a lot of information there.
Thank you.
All right, I believe we have nothing from, oh, Brenda, we have something for us, so we have some positions that need to be taken care of and an agreement. Brenda?
Yes, the first one is an approval of an agreement with the Allegheny County Association for the Blind and Visually Handicapped. And we budgeted a $10,000 annual appropriation for them, and we just need to enter into an agreement for that with them.
Rumfeld will move.
Ricketts Swales, second.
Any questions or comments? Brenda, has this been the same amount for several years? Has this increased at all?
This increased, I think it was 2 or 3 years ago. It went from 8,000 to 10,000, I believe.
Okay, thank you. All in favor?
Aye.
Carried. And then the second one is an appointment to the Youth Board.
Yes, we have 3 reappointments, Jack Emmerich, Michelle Henry, and Michelle McGraw. And that's for a 3-year term from March 26, 24 and expiring March 25th, 27. And these appointments are subject to confirmation by the board.
A motion to reappoint those 3.
Rumpfeld will move.
Hanchett seconds.
Any questions or comments? All in favor?
Aye.
Any opposed? All right, those 3 are carried, and then we have a new one.
Yes, a new appointment, Wendy Butler.
I have a motion to appoint her to a 3-year term.
Rumpfeld will move.
Stockton, second.
Any questions or comments? All in favor? Anyone opposed? All right, thank you. That takes us to new, old business, new business, good of the order. Can I have a motion for adjournment?
As there appears to be no other business to come before the Human Services Committee this afternoon, I'll make a motion to adjourn.
We have a second.
Ricketts Swales will second.
All in favor?
Aye.
Carried. Thank you all.